patients make an appointment with us because they have toothache in the third molar. I'll show you how we look at it as dentists. You've got a bite wing and you've got a periapical, and the last one that we showed you was a panorex. See, the tooth gets really loose like that. Now you gotta make sure you're seeing it. So patients come to our office with tooth pain, and I'm going to show you a situation here where patients make an appointment with us because they have toothache in the third molar. I'll show you how we look at it as dentists and how we assess a tooth on an extraction. Now, first of all, what we have to do is make sure that we are taking an x-ray. One of the x-rays that we take would be what we called a panorex. A panorex looks like this, and where we are looking at a particular tooth in here, which is the third molar on the lower right, which is what we call number 32 when you go to the dentist. Lower right, third molar is the complaint that the patient have on this situation. Another x-ray that we take is what we call a periapical x-ray, which will show that that tooth has a curved root, and what we have to do is plan on what happens if that tooth breaks right at the tip of the root. So we've got to make sure that we avoid having to retrieve that root if it breaks. X-rays that can be taken is what we call a bite wing. So you've got a bite wing and you've got a periapical, and the last one that we showed you was a panorex. So we're looking at that tooth that we're going to pull out, assessing it with x-rays with a bite wing PA and a panorex. And so what we're going to do first is let the patient know that we are going to pull this tooth out, and we're going to use the anesthetic. And by the time he goes home, make sure that he puts pressure on that tooth so that we could get the blood clot going at the end. The first thing that you have to do is numb the tooth up. We're going to be pulling this wisdom teeth. So the first thing you'll do is numb this up, and then we're going ahead and doing anesthetic here, and then also here in the lingual part. And then you could also put it right here in the side of the teeth on the mesial, and then in the distal of the wisdom tooth. You could also put anesthetic up here so it'll numb up the whole jaw. But when we're doing something like this, you don't have to extract a tooth with your whole jaw. After you numbed up the tooth, we are going to go ahead and sever the PDL. And severing the PDL means that you're going to go here and then try to loosen up the tooth by severing the PDL here, and then you could go right here. So what you're doing is you're severing the PDL right here, and then you're also severing the PDL over this side on the lingual, and then you could retract it by going like this. Right here, severing the PDL. Okay. And then when you have a hard time trying to reach these PDL, you could use a different instrument. So you could go right here on the side, and then also the lingual part right here. Right here, you're severing the PDL here. Did you feel that? Okay. And then you could go on this side, sever the PDL right here. So once you have separated the tooth from the gum, the tooth starts to become really loose. Okay. Now, one of the things what we have to do is start to wiggle that tooth, and we could surely use a elevator like this. And then the elevator is going to loosen the tooth from the bone. You go like this, right here. See this tooth right here is gonna get loose right there. Now open. Did you see that? Okay. So we're gonna do, make sure that you can see this. See the tooth gets really loose like that? Mm-hmm. Now you gotta make sure you're seeing it get loose. I'm gonna change this right here. Okay. Get good access and get the tooth really loose with the elevator like this. Once you got it really loose already, see how loose that is? Mm-hmm. Once you got that really loose, then you could use a forceps like this to grab that tooth. And then you grab it right here, twist it a little bit. So make sure that you get good light. Twist it a little bit, like this, back and forth, side to side, and then when it comes out, open wide, open. Tooth comes out with a big curve in it like this. See it? And so once you've gotten the tooth out, you've got to make sure that you clean that tooth, the socket, and get the infection out. Okay, the infection's out here. Okay? See right there? We'll get a little piece of that tissue there. And we'll get it with a let's see. Clean that tooth out like that. And then the instruction for the patient is we're going to have to get some gauze like this so he could bite on that tooth to stop bleeding. Now bite down, bite. And hold it like that for a good 30 minutes, okay? Mm-hmm.